Hi everybody, Dr. Rehman. So I'm going to try to differentiate the low back pain from spinal stenosis versus arthritis causing facet joints, the joints on the back, to be painful. So I'm telling you what my experience is. So in both cases, you're dealing with arthritis of the spine. Stenosis is when the canal in the middle becomes tight. So with standing and walking, because the nerves are on the back, with standing and walking, the spine arches back a little bit. That kind of jumbles up the ligaments and other structures in there because the length of the spine back column decreases a little bit, and people start to have back pain with standing and walking for maybe a few minutes. And classic improvement is that if they lean forward on a grocery cart, they seem to improve. Arthritis of the spine with facet joint arthritis will also cause pain with standing and walking. Usually they will have pain probably much more quicker as compared to spinal stenosis, because it usually needs a little bit lead up time for the nerves to start getting pinched enough to start causing pain, but that's not necessarily absolutely true for all the cases. But one thing that I found in my life and career is if I bend them back and bend sideways, then the acute biomechanical irritation of the joints happens. So the arthritis patients with facet joint pain will usually have increased pain with bending back into the sides, whereas spinal stenosis not so readily, because their pain is not biomechanical but from the mechanical pinching of the spine. And many times you can see two different kinds of pains if you listen to the patient. These can travel together also. Spinal stenosis patient will have certain amount of neurogenic claudication, but they'll come after a bit, but then at the same time they have biomechanical facet joint pain. So if the exam is positive, I will simply try to do facet joint blocks and see what percentage of pain is from the facets and what is from the spinal stenosis probably. So I'll come and explain about these things later, but this was a nice, just a simple pearl, how to differentiate what's causing the pain. Take care.